Hey guys, I am Captain Living a Legacy, and I am here to talk to you all about something which is happening at this very moment. And I want to make this video to show you guys what you can do with this and how you can help each other. So the video is based on coronavirus, COVID-19. And to give a brief summary of what this is, it's a disease that can be very deadly with flu-like symptoms that unfortunately can take lives. But the reason why it's so serious is how quickly it can spread and how bad it can get. So about the video, it's going to be about advice of what you can do to help others, yourself, to help prevent it from getting worse, and just general knowledge and understanding to help people who are worried and who are panicking and not knowing what to do in this situation. So I'm going to show you all a website which I have found, and hopefully this will give an information to you all and give you ease of mind about what you can do in this situation. So this website is called CDC, Centers for Disease Control and Prevention, and I can link the website below if you guys want the website or want to look onto it. So the first thing I want to show you is how it spreads. This is priority to show. This part is very important. So it says it's from person to person spread. So the virus is thought to spread mainly from person to person between people who are in close contact with one another within 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in mouths or noses of people who are nearby or possibly be inhaled into their lungs. Can someone spread a virus without being sick? People are thought to be most contagious when they are the most symptomatic, the sickest. Some people might be possible before people show the symptoms. There have been reports of this occurring with this new coronavirus, but it's not thought to be the main way the virus spreads. So in other words, putting it into perspective, this virus was only discovered within last year, 2019, and a lot of people's bodies are not aware of this. So in other words, what it means is, if it comes to something like the common flu, our bodies know that's the flu, so in other words, we're able to fight it off as quickly as possible. So our bodies is like, okay, well, this is the flu, we know the symptoms, we can get our cells to attack it and get rid of it ASAP. With the coronavirus, our bodies is like, whoa, okay, well, we don't know what this is. Is this some sort of disease? Is it a bug? Of course, then your body's panicking at this point, like, what do we do? Do we fight this? Do we let it stay? So, of course, we're not known to know what this is, neither is inside of our body. So, a lot of people are getting worse because their body's not able to fight it quickly. And it comes to like the elderly or the people with health conditions, people with weaker immune systems, because their body doesn't know how to respond to the disease itself. So therefore, it won't fight the disease, it will let it attack because it's not able to defend itself, basically. So that's in a way what it's saying as well. Spread from contact with contaminated surfaces or objects. If you touch a surface which has got the disease on it, therefore you can actually still pick it up from there, and it can be on like your hands, on surfaces, things like that. So therefore, what they're saying is make sure surfaces are clean, make sure you're cleaning your hands regular, washing your hands, things like that, making sure surfaces are properly cleaned, that even if you have to bleach them, it's priority to do that. If there's a surface someone else has touched, don't touch it yourself, try and avoid contact with it as much as you can. That might be the best option, and it stops it from spreading so quickly then. How easily the virus spreads. How easily a virus spreads from person to person can vary. Some viruses are highly contagious, spread easily like the measles, but other viruses do not spread as easily. Another factor is whether the spread is sustained, spreading continuously without stopping. The virus that causes COVID-19, coronavirus, seems to be spreading easily and sustainably within a community, spread in some effective, say, geographic areas. Okay, and obviously that's just explaining countries where it could be. So, go back. Okay, ooh, I'll do that later. Okay, symptoms. Okay, so first thing it states, call your doctor. Yes, do not go to a hospital. Call your doctor ASAP if you notice any of the symptoms. And I cannot stress that enough. Do not go to a doctor's appointment, to the building itself. Stay home. Just make sure you call your doctor. Do not go anywhere to like a hospital, because if you do have the coronavirus, you could spread it to other people straight away. So call the doctor if you think you have been exposed to COVID-19 and develop a fever and symptoms such as a cough or difficulty breathing. Call your healthcare provider for medical advice. So yeah, the symptoms, this is the main thing that you need to be aware of, and you need to let other people know too. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease 2019, because that was when it was discovered, as I've said. These symptoms may appear 2 to 14 days after exposure, but it can vary with different people. So the symptoms, the main thing here which we need to look at is a fever, which you can get, sort of like what you would get for a flu, like cold, hot, sweaty, clammy, feeling sick, things like that. You'll get a cough, as like you have a sore throat or a chesty cough, because it affects your lungs, as you can see in this picture here. Shortness of breath, it can take away your breath and could cause you to struggle to breathe. So yeah, there's like a picture, sweating, clammy, struggling to breathe, and a cough, and it affects the lungs. So it says here, if you develop emergency warning signs for COVID-19, get medical attention immediately. So in this case, if it gets really bad, then call either where you are, the emergency landline 999 for England, 911 for America, or wherever you are, etc. Like, make sure you call the emergency team in this occasion. If it's not serious symptoms and it's just the main ones, which is the ones up here, then just call your doctor for advice. Because if you have the symptoms but then it's not severe, number one, you're going to a place where people could be more worse than yourself, but then you could easily treat the symptoms yourself if it doesn't get out of hand. Obviously, people who are more stronger in their immune systems who are not unwell, etc. Okay, so if you need the emergency team, if it gets out of hand, you could have trouble breathing, persistent pain or pressure in the chest, which is kind of similar to like what you would get for a heart attack, new confusion or inability to arouse, I guess, bluish lips or face. So that means you could get really bad, like the state of ended up being in a coma, or you could end up just collapsing or becoming unconscious. So in those cases, definitely call the emergency team ASAP. But if it's not that severe, just call your doctor for advice. But do not, I will say this again, do not go to a doctor's and do not go to the hospital, because you will spread it to other people. So it's not safe, basically, and it's not good. Okay, so the next part I want to show you guys, prevention and treatment. Okay, so older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19. So in other words, people who, as I've said, have got weaker systems, who have those kind of diseases, has, like it says here, lung disease, diabetes, like COPD, things like that, it can be very deadly for them because they are a lot weaker than the people who do not have that and have stronger immune systems. There is currently no vaccine to prevent coronavirus disease, COVID. The best way to prevent the illness is avoid being exposed to this virus. The virus is thought to spread mainly from person to person, between people who are in close contact with one another, as I've said, through the droplets, as I've said before. So the main steps that we need to take, this is for everybody, not just one person, for everyone. Clean your hands often. Wash your hands with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing or sneezing. If soap and water are not readily available, use a hand sanitizer that contains 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose and mouth with unwashed hands. That's a priority, guys. That's very important. Avoid close contact with people who are sick. So if you've been near someone who has a cough or a runny nose or cold or any of the symptoms, then you may have to self-isolate. But if you haven't been near anybody who's like that yet and you're finding yourself, avoid contact with them. I know it sounds horrible to have to stay away from people, making it look like they're a disease and that they're bad people and that, but they're not. But the reason why you have to do this is because you can easily get the disease from them. It attracts so quick. So yeah, avoid close contact. But like I said, if you've been near someone who has the symptoms, go straight home, call your doctor for advice ASAP for what to do, but more than likely they will tell you to self-isolate, so you have to stay by yourself in your home, apartment, flat, etc. for about 14 days to make sure, and precautions wise, that you are safe and that you do not get unwell, and just for everybody else's safety in case you do pick up what they've got. So stay at home if you're sick and contact your medical professional. Cover your coughs and sneezes. Use your inside of your elbow, which it says here. Don't cough in your hands or sneeze in your hands. Try to avoid that. If you use tissue, throw it straight into the bin or down the toilet. Flush the toilet. Wash your hands straight away. Like it says here, immediately wash your hands with soap and water for at least 20 seconds. Or hand sanitizer as stated as well. Wear a face mask if you're sick. A lot of people will be doing this, and yes, I agree, this is a good way to do this. So if you do have the symptoms and you are sick, wear a face mask, because a lot of the coronavirus will be from the mouth. That's the main area and it can go into people through the mouth as well. You do not need to wear a face mask unless you are caring for someone who is sick and they are not able to wear a face mask. So if you're like a nurse or a doctor and you're looking after someone who has the symptoms or has coronavirus and they're in isolation or in quarantine with yourself, wear a mask but keep yourself safe at the same time. But make sure you wear the mask and wear gloves as well. I don't know if that's been put on here, but gloves is another good thing as well. Clean and disinfect the areas, as I've said, about touching an area where someone else has touched it with their hands. Keeping it clean, using bleach and stuff like that is a good way of doing it. Just general kitchen cleaner, just any kind of disinfectant that you can get your hand on. Please use that and keep the surfaces clean as much as you can as well. So yeah, this is mainly just about what you could do, what ingredients to use to clean, I guess. I won't need to go through any of this. What to do if you're sick. I have already said a few of these things, but I will show you again. So stay home. People who are mildly ill with COVID-19 are able to recover at home. This is the people who are with a strong immune systems that don't have any health issues. Stay at home, do not leave, except get medical care. Do not visit public areas, like even parks. Try and avoid that. Do not go out at all. Stay in as much as you can. There are things you can do in the meantime. Watch films, watch movies, listen to music. There's a lot of things you can do as long as you've got stuff stocked up in your house. Food, drinks, etc. You should be okay. Avoid public transportation, most definitely. Taxis, buses, do not use. Whatever you do, stay in touch with your doctor to get medical advice, most definitely. Stay away from others. As I've said, it sounds horrible, it really does, but this is good in terms of keeping everybody safe. And limit contact with pets and animals. I know this could be hard because a lot of people like their pets and like to give them a hug and a kiss, and just generally like their pets in general and looking after them and giving them comfort. But if it comes to something like the coronavirus, even though pets can actually not get it, it's still not pleasant for them, and plus, it's just trying to keep yourself well is the main priority as well. So you may need to get someone else to help with the animals in the house, looking after them, feeding them, etc. while you're in having your quarantine or your self-isolation. It's a priority for someone to do that as well. If someone in your home is sick, basically, I won't need to click into that because all you have to do is tell them that they have to be in self-isolation with you or in quarantine, and they just have to follow the same steps that you are taking by calling your doctor, keeping clean, wearing a face mask. So just basically the same similar things. Oh, this is a good one. Avoid sharing personal household items. So for someone who hasn't got the symptoms or is not unwell, try to avoid contact with what they've held. But if you do necessarily have to hold something that they've held, put gloves on, make sure you clean the surface ASAP, or just generally use a different object. That's what the best thing that can be done. Or a good one as well is monitoring symptoms. Just keep an eye on them in case they get any worse as well. As a medical emergency, as I've said, call 911 if you've got really bad symptoms. But if you've got no big major symptoms, then call your doctor for advice. So self-isolation, I know it can be an absolutely horrible thing, and I know a lot of people do not want to do this, but to be honest, it's better to be safe than sorry. Even if you haven't got the symptoms, but you've been near someone who has, you will have to self-isolate. It's the best solution, and it prevents it from spreading much worse. So I won't go into this page anymore because I've basically covered everything that it says. But I will post a link in the description below of this website as well, so you can all read through this more thoroughly if you want to, and get any more information that you need for it as well. So, sorry, excuse this. Okay. So yeah, overall, that basically covers a lot. There is something that they haven't actually put on that website, but is what I know. I've got a professional doctor's advice about this. If you have to go out to get groceries, this is another thing I want to put across. If you need to get food in and you haven't got food in, drinks, I would say don't stay in. I would go out and get them. But if you have to go out and get them, wear a face mask if you have the symptoms. Try and limit as far away from someone as you can, or people in general. And try to avoid touching somebody's stuff, like your face. If you do sneeze or cough, in your arm. Just generally be careful. If you have to go out and get groceries and stuff, it's understandable. No one's going to judge you for that. It's priority. People got to eat at the end of the day. People have to drink. And that's what keeps us alive and keeps us going. So we have to do this. But just limit the distance between people as much as you can. Just be cautious and understanding about this. But another thing I want to put out as well to you all is to try and not to panic. I know right now it seems scary because we don't know what the outcome is. Everybody's quarantining, everybody's self-isolating because they're panicking about what the solution and what's going to happen from this now. We don't know if this is going to end. No one knows. But the worst thing for everyone to do right now is to panic. The more we panic, the more it can get worse, and it doesn't help. And I want to say another thing. If there's anybody watching this right now, and I will put this out, and I don't care what anybody else thinks about what I'm going to say right now, if you are considering panic buying, just don't even think about it. Because it's not fair, because there are other people, vulnerable, the disabled, the elderly, who struggle to get to shops every single day and back to get food and groceries, and people are careless enough to go out and panic buy, just grabbing everything off the shelves and going away, leaving nothing for other people. It's unfair, it's not nice, and those poor people now have to struggle to get food and supplies in because everything's gone and the shops are empty. Especially things like toilet rolls. It's not needed to panic buy. People don't need to panic buy anyway. There's no need for it, and please be respectful in minds to other people who have to get stuff in, because the amount of shops I've gone in and they're empty. I've had to get kitchen roll instead of toilet paper because there's none left, because people have gone out carelessly, panic buyed, and just removed it all. So please be respectful and keep others in your thoughts, and please understand that other people need the stuff just as well as you do. I can understand, as I said again, why people are panicking, but panic buying does not make a difference. And of course, you're putting people into crisis with getting things in their lives now, including food. And people now are trying to survive because they have to grab what they can. And that's all down to carelessness. So please keep that in mind. Please be respectful. If you're considering to panic buy, please just don't do it. Don't. It's not fair. So I wanted to stress that. And because that's very, very important for everybody right now. But as I've said, please try not to panic. The only things we can do right now is be calm and cautious about this, because we don't know what's going to happen. It's unpredictable. But we just have to take the steps that we can at this time. We have to take the measures we've been given. Just follow what your doctors are saying, follow what your governments and people are saying, and try and help everybody as much as you can. Help your family, your loved ones. Help everybody. If you want to do something, make sure everybody's okay, the people you love. Make sure your family's okay. Give them a call. Give them a face chat. Don't hesitate. Don't self-isolate and just completely shut the world off. Still communicate with your loved ones. Still communicate with your friends. Do things online if you have to. Watch a film. Just anything that you could think of in, self-isolation. But don't cut everybody off. But just take care of each other and keep yourselves well at the same time. That's all we can do right now. But just be calm and cautious. And I created a hashtag which was very important, which I will be using in this video as well. I will post that below. And I pasted it in a lot of places as well, shared it along. The hashtag is use your head, slow the spread. So with everything I've just discussed about what we need to do in this time right now, is to use our heads. We need to be sensible and use our brains with this. So hashtag use your head, slow the spread. And I will put that down in the description below. And please share this hashtag so other people are aware of what to do and know that this is a time to not panic, but be calm and cautious about this. Use your head, slow the spread. So I'm going to end this video here now, because this is going to be a very long video, and probably don't want to repeat myself after everything I've said. But the main thing is take care of yourselves. Look after your loved ones. Stay safe. Do what you can in this time. Don't panic, please. Keep calm and cautious. Hashtag use your head. Slow the spread. So take care of one another. Obviously, as I said, we don't know what the future is going to bring, but we just have to prepare ourselves in the meantime and do what we've been given and instructed. So take care, guys. And you are all amazing people. I'll see you soon. Take care. Bye.